back to Breakfast Television. We're joined now by Dr. Zach Levine, ER physician at the MUHC. Welcome to the show.
Thank you.
And we have I didn't want to say juicy twice, so I won't. We have an interesting topic today, STIs.
Yeah.
And why is today the STI day?
It's not really today, but what we know is that the rates have been going up. For 20 years, they've been going up steadily.
And why is that? Are people just not as careful?
I think that's a big part of it. People are not careful. People are not using condoms, basically, so that's the only one that really protects. People know contraception protects them, but it's from getting pregnant. It's not from... The only thing is a barrier that will protect you from catching an STI, also known as STDs, for those of us who are more used to that.
Well, I was going to ask, is there a difference between an STD and an STI?
No, it's just semantics, and I think people didn't like calling it a disease.
A disease.
Yeah, exactly. So infections is a little more benign, I think.
Right.
But basically, it's the same thing. Yeah, and they're going up. There's no doubt it's going up. And the other reason why people postulate that the other reason is because of things like Tinder, where people have more access to sex. Yeah.
And so how do you stop that? How do you inform? It's mostly, obviously, the younger people, right?
Yes, exactly. It's mostly under 30, even mostly between 16 and 24, although there are rising rates over, like, 50. There's clearly rising rates over the past 10 or 20 years over the age of 50.
Over 50? Why is that? The divorced kind of soccer moms and
I guess so. And again, people are more sexually active, and they're not necessarily careful about it.
Now, what about seniors' homes? I've heard that they run rampant in the seniors' homes where, you know, somebody's grandpa and somebody's grandma are like, hey, you're cute.
Yeah.
I don't know if that's what they say.
My understanding is it's going up. It's definitely going up a lot among seniors, for sure. So education has to be for young people, but older people as well. We have to realize we're never immune.
Now, how do people know if you have one? Because sometimes there's no symptoms, right? Like I was telling him that my doctor had told me at one point that something like 90+% of people have had HPV at one point, which is crazy.
Well, so that's the problem exactly. Most people are exposed to something. HPV is a very, very common one, but the nice thing is we have a vaccine now. And Hep B, you know, there's a few vaccines out there. But how do you know? The problem is sometimes people are not, especially women, are not symptomatic. So if there's symptoms, there's usually pain, there's discharge. That's for both men and women. There's pain when urinating, both for men and women. And sometimes there are lesions, right? So, you know, warts, that sort of thing, or other lesions on the skin and the genitals that we don't recognize. They should be checked out. But the problem is sometimes they're asymptomatic. And what's dangerous is things like chlamydia and gonorrhea, you can have, especially in women, they can have them and not know, and then it can cause infections and actually affect their fertility later on. So it's important, if people are sexually active, especially with multiple partners, to get tested. And some people actually come into the clinic. I haven't worked in a clinic in a while. I work in the Emerge, but some people will come in, new couples, before they're sexually active. Yes, and they will ask for testing.
Kind of like a contract saying, like, let me make sure buddy here is clean.
It's not a bad idea. Get tested before, and then you're safe. And then, you know, you can decide not to use contraception if you want to have a baby, you know. Right,
exactly. Yeah. And then how scary is it if you do find out that you have one of these?
Well, it depends. I mean, the truth is it depends which one. It's not. It shouldn't be terribly scary. The ones I mentioned before, the ones that we know are increasing, like syphilis, gonorrhea, chlamydia, those are all curable with antibiotics. Those are bacteria, and we can treat with antibiotics. The ones that are potentially more scary, although I think part of the reason people aren't scared anymore, years ago, you know, back in the late 90s, HIV, AIDS was a death sentence. But now it's really a chronic disease, but meaning people can live for a long, long time with it. But so people aren't scared of, you know, it killing them. But the problem is it's not curable like other viruses. There's a couple of viruses we can prevent with vaccines. We talked about HPV, we talked about HIV, but other ones like herpes, there's no, you know, there's control. And HIV as well. There's no vaccine to prevent them, and you do have them potentially for the rest of your life.
Wow. And how and where do people get tested if they want to go?
You can go almost any clinic can arrange it. Not all clinics have the facilities to actually do it there. But most clinics can certainly point you in the right way. And there are hospitals. I know, for example, at the Jewish, there's an infectious disease clinic that's open to the public. I know there are infectious disease clinics at all the hospitals. But honestly, if you have a doctor or if there's a clinic near you and you want to get tested, show up there, and they'll arrange it for you. They'll know how, yeah.
Dr. Zach Levine, ER physician at the MUHC. How can people get a hold of you? Do you have a website?
I do have a website, yeah, drzach.ca.
Okay.
Yeah.
And any last words of advice for young people out there that bring your raincoat?
Bring your raincoat, exactly. Protect yourself. The only way to protect yourself if you're being sexually active is with a barrier contraceptive. So that's a condom.
You've heard it here first. Thanks, Dr. Zach.
Thank you.
Stick around. More on Breakfast Television coming up right after this.